Hello, I'm Dr. Beth Godey.
And I'm Dr. Martha Leatherman. I'm a geriatric specialist in psychiatry.
And I'm a neuropsychologist specializing in aging, and we are dementia experts. You know, we get asked a lot of questions from families and our patients, and one of the most common questions we get from families is, why doesn't my loved one admit that they have Alzheimer's, or why don't they accept that they have dementia?
Is that the way that they ask you in your practice, Dr. Godey? Is that usually the kind of question that comes across?
They do, but also more frequently is, if only my loved one would accept that they have dementia, then we could make some plans and then things would be better.
You know, as a psychiatrist, a lot of times I will hear from families, doctor, if you told my loved one that they have dementia or Alzheimer's, then they would accept it and would realize that they can't drive anymore, or would realize that they need help with finances or whatever it is, as if some authority on my part would make it believable to them.
That's right. Or as if some piece of paper or some legal authority could change their minds, and once they realize that they need help and they actually have dementia, then everything will be very easy in taking care of them. That's what families hope would happen. But the issue remains, why doesn't the person admit and accept that they have dementia or Alzheimer's and they need help?
Well, sadly, there is no proof that any expert or any authority can give these people to make them fully accept the problem. And there's a biological, a chemical, and a physical reason for that. The part of the brain that is responsible for insight, for understanding the way in which you relate to the world, deficits or deficiencies you have, problems that you have, that part of the brain does not work in dementia. So without a part of the brain to accept the information that dementia is present, the person simply cannot act on it. It doesn't stick, in other words. As a neuropsychologist, Dr. Godey, how would you describe the role of insight in this problem of understanding that you have or don't have dementia?
Well, many of the families I talk to really can't understand about insight. They think that if their family member, if their loved one says, well, yes, I have some memory problems, then they're aware and accepting of their dementia, but it's not true. It's a very superficial level of insight. The person doesn't really understand that they need help because they have the memory problems or the difficulties with thinking and reasoning. And no amount of persuasion or logical reasoning or argument is going to change that. And that's when families spend a lot of energy trying to get the person to accept that they need help, when it's not really going to get them anywhere, unfortunately.
So they might even recognize deficits like, oh, I'm having trouble remembering things, but everybody my age has trouble remembering things. They don't really understand the implications of that for needing assistance and for their daily living.
Exactly right. And that's what's so frustrating for families, is that they think, well, if I just talk about it some more, they'll come to realize that they have a problem and that they need to accept my help.
And what we're here to tell you as neuroscientists is that the reason there isn't that level of insight is because the person with dementia simply cannot do it. The part of the brain that is responsible for having the insight simply doesn't work. So it's kind of like there's nothing for the information to stick to. The brain can't process the information to understand what to do with the information that they have dementia, and can't act on it. So like Dr. Godey says, it's really not in anybody's best interest to spend time arguing or persuading. What you have to do is move on and make plans for the safety and the health of the person with dementia.
And in future installments, we'll be talking more about how to do that and some of the ways you can manage the stress that's related with that. I think the next installment we're going to do, the most common question we get is, how do you determine if someone has dementia?
What kinds of medical tests? What kinds of professionals? Is it something that you just know? Can you do a blood test? We'll talk about all those things.
So I'm Dr. Beth Godey, and this is Dr. Martha Leatherman, and we hope to see you next time.
For more answers to questions like these, our book, The Insider's Guide to Dementia Care, is available at Amazon.com.